Hi there, Dr. Sam Curtis here. Right now we're going to be talking about round ligaments. Round ligaments are actually in the front of your abdomen. They're not in the back, so most of the time people come to a chiropractor and they're like, why are you working with the front of my body? My spine's in the back. I'm like, well, it's all connected. I make the joke all the time with my patients that it's almost like your toe bone is connected to your hip bone or something. It is. So what we're looking at when we're looking at the round ligaments, and this is a portion of Webster protocol, which is again a technique that we use predominantly on our pregnant patients, it does assess the round ligaments. Now before the 12 to 16 week gestation mark, depending on if it's your first pregnancy, your frame, and a bunch of other factors, your baby is actually tucked beneath your pubic bone. So we're not really necessarily looking for round ligaments. However, after that, it's good to make sure that things are even side to side. If you were to think of your uterus as a hot air balloon, so your uterus typically is about the size of your fist until about 12 weeks. It gets a little bit bigger, and then it starts to expand even more. So when your uterus is up like this, we want to make sure that if your uterus is like a hot air balloon, that your baby has all the room it needs to just find the exit and move around and do all that fun stuff that keeps you awake at night. But if you have a round ligament that's tight, it's going to create sort of a different space, and the baby doesn't have as much what we call real estate to move around. So this oftentimes leads to situations where, if you've ever heard of a person whose baby was breech and the baby turned head down after chiropractic care, a lot of times it's addressing those round ligaments that help that baby find their way out. So that's number one. Number two, if you've ever heard of someone complaining of lightning crotch, which is a great thing that a lot of women will discuss with you, it's when you have a sharp shooting pain down into your groin. A lot of times that's actually your round ligaments giving you grief. The round ligaments are just like any other part of your body. As they start to expand and grow with your uterus, there will be aches and pains. This is a great way to moderate those and help reduce the pain, and also make sure that everything is growing the same side to side. One of my favorite tools to do is, as a couple gets closer to delivery, having your birth partner come in with you, I can actually show them how to help you when you're in labor release those round ligaments. There's also some really cool resources on spinning babies for helping to ensure that the pelvis is nice and balanced as well. If you have any questions, please let me know how I can support you by commenting on the message board below.